Dumelang, sanibonani, molweni, lotshani. Ngiyanamukela kuhlelo lwethu ezempilo zwami uDakalo Dr. Pro. Namhlanje sibuka udaba olubaluleke kakhulu olwenzeka enganeni lapho zitholakala zizalwa khona nalesifo esisibiza ngokuthi i-Down syndrome. Njengoba sazi ukuthi namhlanje ilanga lapho umhlaba ubungaza khona ngayo i-Down syndrome, sifundisa sixwayisa ngayo i-Down syndrome. Kanti namhlanje nginezihambeli zethu abazozichaza ukuthi bangobani, basuka kuphi, kanti bazosinceda kanjani. Sizozwela ke ngabo. Singaqala ngawe dokotela.
Ngiyaleboga Prudence. Kina Dr. Motlatsi Mokoape. I'm an obstetrician and gynaecologist. And based in Johannesburg, both in private and public hospitals. In terms of my background, I studied medicine at Medunsa, that is now called Sefako Makatu. And from there, I went on to worked as a GP a bit for a while, and then I went on to specialize under the vet circuit for obstetrics and gynecology, and qualified under the College of Medicine of South Africa. So I have been working for a number of years now, as an obs and gynae, and my interest is in women's health, and I think which is why I did obs and gynae.
Yes.
That's lovely. Oh, thanks. Thank you, Doc. Yes, my name is Lisimole. That is my surname. I'm actually an occupational therapist, and I qualified from the University of the Western Cape. That was a long time ago. Ki Free State, in a small town called Clocolan. And from there I attended school in the same place until high school. From there I went to University of Western Cape. So I've also been working for a couple of years. And I'm one occupational therapist that has interest in kids. But as it is now, I'm in private sector. I left government after working in government for over 10 years. And I'm loving it, and thanks for inviting me.
Thank you so much.
Sambonani igama lami Zandi Goliath, ningangibiza ngoZandi. I am a genetic counseling intern at this point. In terms of ukuthi ngikhulele kuphi, I grew up in a town called Boksburg in Gauteng. Ilapho ke ngayenza high school yami high school abayibiza Summit Park High School. Mase ngiceda lapho ke ngayenza Bachelor of Nursing yami at the University of Wits. Mangisuka lapho ke ngasebenza in a public hospital in Free State, and then ngasuka lapho ngasebenza in corporate. Ilapho ngasebenza as an occupational nurse. Ngayenza isinqumo sokuthi ngingathanda ukuthi ngiqhubeke nezifundo zami. Ngasuka lapho ngafunda genetic counseling. Ngi-based at the University of the Witwatersrand and at the National Health Laboratory Services eBrakfontein.
Awusithathe nje khona lapho Zandi njengoba usathi ufundela ukuba genetic counselor. Yini kahle le genetic counselor manje usiyenza?
Okay, so kunama university awuthu kuphela in South Africa that offer genetic counseling. It's at UCT nala eVits. Mase sikhuluma nge-genetic counselor, I think kufanele understand ukuthi i-genetics yini.
Yes.
I-genetics ke siyazi ukuthi imizimba yethu yenziwe ngama-cells amaningi, so millions and millions of cells. Kulama cells lawa kune-genetic information etshela umzimba ukuthi ufunctione kanjani nokuthi ukhule kanjani. Kuyenzeka ke ukuthi kube namaphutha ke ayenzeka kule genetic information lawa. And then it results in genetic conditions afana ne-Down syndrome esobe sikhuluma ngayo namhlanje. Thina ke umsebenzi wethu as ama-genetic counselors sisebenza specifically la eGauteng, sisebenza kuma-specialized hospitals or ama-tertiary hospitals, which includes iCharlotte Maxeke, iPara, Rahima Musa, and Helen Joseph. Ila sidila ngama-prenatal cases, abomama abakhulelwe, siphinde sidile ngama-cancer cases, siphinde ke sidile ngama-general genetic conditions in adults and young children. Lapho sikhuluma ngokuthi yini lesimo abaphethwe yiyo in terms of genetic condition yabo, nokuthi iyenzeke kanjani, nokuthi amathuba ukuthi iphinde iyenzeke kumanye ama-pregnancy angakanani, siphinde sikhulume ngokuthi silawula kanjani leyo genetic condition.
So kuthatha isikhathi esingakanani ukufundela because uqale waba yinesi ubunesi kuthatha isikhathi esingakanani
4 years.
4 years and then
And then genetic counseling is a master's degree, 2 years.
Also it's 2 years in total so fundesi for 6 years.
6 years.
Yes.
Ungabuke kumncane kanti njengesibongo sakho uGoliath ngempela when it comes to food. Doctor.
Yes, ma'am.
A re bolele mo. Es a tlhalosetse hore ho na le di genes ka Down syndrome. Ho irahalang?
So basically, when it comes to pregnancies, pregnancies are different. And that is why we always advise women to seek assistance early in pregnancy and attend antenatal clinic early so that we are able to identify risk. It starts there. Okay, so it starts with screening. So you screen women, a pregnant woman comes to, say, a local clinic, isn't it? And then at the local clinic, they will then identify whether she falls under low risk or moderate risk or high risk, right? So most of the time, if it's your first time pregnancy, para 0, gravida 1, then they will be classified as low risk, right? But depending on age, if you are a first time pregnant woman, but you are 18 years old, and you are 25 years old, and you are 35 years old, and you are 45 years old. It's totally a different scenario, remember? Then we look at also, based on that age, what is called advanced maternal age, okay? Where we know that the risks will be higher, even if it's your first time pregnancy, but then it means we move you over now. You become moderate or high risk, and we refer you to a center where they will be able to deal with issues of high risk. Then the second thing we talk about is early booking. The earlier you book, the minute you realize that you are pregnant and identify that, you need to book. You need to either seek help at a GP or local clinic or even a hospital, but obviously the starting point is the local clinic, right? Then how fita corona hospital at about, let's say, 5 weeks, then we do a basic dating scan, as we call it. We just want to check how far you are, is there a heartbeat or not, is it is the pregnancy inside the womb or not? Then we are fine. Then we're going to then counsel you that, okay, we'd like to see you at about 12 weeks, between 12 and 14 weeks, or 13 plus 6 days, as we say it, where we are now going to be doing a special investigation on SONA and also take blood to identify that we commonly look at, that the people have an understanding of, at least, is Down syndrome. Okay, so at that time, we check for what is called beta HCG, and then we check for what is called PAP-A. I think you know how that works. Yeah, you can explain better. And then from there we do a SONA. We identify now chromosomal abnormalities at that setting. So for Down syndrome or other syndromes, there's 2 other that we commonly look at, which is Patau syndrome and Edwards syndrome as well. It's a melanale when we look for Downs, right? We check the nose. Is it too flat? Is it not flat? Is it high? We check the ears, and then we measure the neck, and we call it an NT measurement, and more. And then overall, the blood results, what was done on SONA measurements, and they come together, and the age of the patient, and the risk, if it's a woman who has had kids before, and maybe they have identified that there was a problem, then bring it together. Then you can sort of, in all that, find out, or maybe we're at risk of Down syndrome, or there is Down syndrome directly. Okay.
So risk.
Yeah.
Being the risk, it's a moto akare maybe highly pregnant or only high risk.
So the common one that we talk about is age. Right, okay. Yeah. So advanced maternal age, 35 and more, we say, but we are now all career women. We start having kids later, so maybe 40 and more. Then you carry a risk of probably having some abnormalities. We are not saying always. That's why I'm using the word risk. Because when you talk to the patients, when you also don't know, then you need to choose the words that you use, Yeah, so you just say risk of is higher than another person, somebody maybe, let's say, who is 18 years old. But the funny thing, Guru, the very 18-year-old, it can be incidental, and you find that she's got Down syndrome. And probably because it's in her genes, you see.
Okay.
That's where Madame on the other side comes in. It's in the genes. Somebody in the family line has had it. So, you know, we have had cases like those where somebody, 18-year-old, 21-year-old, 25-year-old, boom, we found Down syndrome. So, but if for those patients, by the way, they come to the clinics later, then there's also a 20-week space where also we do a stone again, but also from around 4 months of pregnancy, which is around 16 weeks, also for Down syndrome. And then if we've missed that, our next one is 20 weeks. But 20 weeks now we are looking at structure. It's more visible. Now you check everything that you're looking at is visible, and the fetal specialists, the gynecologists who are fetal specialists, are the ones now who are going to sit with you for more or less around an hour looking at everything in the structure of the fetus, right?
Also, the gynecologist la fapana.
Yes, we do. Yeah, so you do, there's fetal specialists, meaning they go on for a further 2 years full time to do fetal medicine, as we call it. Yeah, or part time. Maybe they can push it to 4 years if you want to do it part time. And those are doctors basically that look at fetuses inside, including radiographers, or as they are called, sonographers, whose interest is in looking at fetuses. Okay.
So that's when we have the sonographers. They are important on that part.
Yes.
Okay, Zandi, sizakhuluma ngale ndaba yejini. Ngicela ukusicacisela ukuthi okay, kahle hle umuntu onormal kunamajini ayingaki, kwenzakalani mase kunale Down syndrome kusuke sekwenzakalani manje? Kulamajini.
Njengoba ngishilo ekuqaleni ukuthi imizimba yethu inama cells amaningi. Mase sibhekisisa ke lama cells lawa emshinini. Masiyibheka from kude siyabona ukuthi kune structure efana ngathi ibhola yewool sibiza iDNA.
Okay.
Igama esilazile leyo. Mase sibhekisisa leyo DNA. Sibona ukuthi sithole leyo genetic information leyo istructure ngama structures esiwabiza ngama chromosomes. Into ebalekile ke masikhuluma ngeDown syndrome. Siyazi ukuthi i-half ye-genetic information yethu siyithola kumama, nenye i-half siyithola kubaba. So silindele ukuthi sibe ama-chromosomes total abe u-46. Awu-23 aphuma kumama, nawu-23 aphuma kubaba. Mase sikhuluma ngama-genes ke, ama-genes apha ama-specific instructions to certain parts of our bodies. Kodwa i-Down syndrome, basically ibhekene nama-number wama-chromosomes. Mase sibheka ke masibheka chromosome number 1 mase sikhuluma ngayo siyazi ukuthi kunama chromosomes ayi2 A1 iphuma kumama nenye iphuma kubaba same for number 2 kuze sifike ku chromosome number 22 A1 iphuma kumama enye iphuma kubaba mase sikhuluma ke ngale last pair yama chromosomes ila esitshela ukuthi lo mntana lo uzoba intombazana noma uzoba umfana mase sikhuluma ngeDown syndrome ke into eyenzakalayo ukuthi ngathanda ukuthi ngikhulume ngegama abalibiza iDown syndrome ukuthi liphuma kuphi lifoundwe uDr Down ingakho igama iDown syndrome kodwa isibhedlela kuyayenzeka ukuthi sikhulume ngetrisomy 21 kuyelinye igama leDown syndrome mase sihlukanisa le gama esikhuluma ngayo trisomy 21 utri ukhuluma nga3 somy ukhuluma ngama chromosomes and then kuno 21 so mase sihlanganisa siyazi ukuthi kuna 3 copies waka chromosome 21 so with Down syndrome silindele ukuthi angithi umntana mase sibheka chromosome 21 ukuthi une chromosome A1 ephuma kumama nenye ephuma kubaba kodwa kuba nephutha eyenzakalayo ukuthi kube nama copies awu3 mase sibheka chromosome 21 eyenza ukuthi umuntu abe ne Down syndrome.
Okay, so shukuthi yilapho kuphuma khona lapho ukuthi ingaba hereditary.
Kuna different types.
Okay.
Yokuthi ama mechanisms or ama causes with Down syndrome.
Yeah.
Mase sikhuluma ngale yokuqala that accounts for 95% yabantu abane Down syndrome. Sikhuluma nge non-disjunction events.
Okay.
What that means ukuthi sibona more in women who are of advanced maternal age who are over the age of 35.
Okay.
Ukuthi umama aze nama chromosome akhe chromosome 21 wakhe babe u2 ubaba aze ne1 bazibe i3 mazibelele ilapho sibona ukuthi i95% yabantu esibabonayo ukuthi babe naleyo non-disjunction events but uDr uDr Motlatsi uye washo eqaleni ukuthi siyabona ukuthi abantwana abomama rather abana 18 bayathola abantwana be-Down syndrome. So leyo non-disjunction event iyenzeka to anybody.
Okay.
So it's not something mhlawumbe oyenzile ku-pregnancy. It's not. It can be associated in the age, but it can happen to anyone.
All right.
Mase sikhuluma ke ngale type ye Down syndrome inherited. Sikhuluma ngama translocations. Ngayazi ukuthi igama elikhulu. So it accounts for 2 to 4% yabantu abane Down syndrome. So kwenzakalani kuma translocations? Mase sibheka ama chromosome. Siyazi ukuthi fanele abe u46. If are over 46, kuba nenkinga. If are lower than 46, kuba nenkinga. Kodwa mase sikhuluma ngama translocations, siyazi ukuthi ipiece ye chromosome enye iswaphe i-exchange nenye i-chromosome that leads to a translocation. So, mangayenza i-example ukuthi mase sikhuluma ngabantwana abane Down syndrome, singathola ke mhlawumbe ubaba une translocation ukuthi i-chromosome 14 wakhe uswaphe no chromosome 21 wakhe. Siyazi ukuthi ubaba information yakhe iphelele akana inkinga. Inkinga ke iza manje sekaphanga ama chromosome akhe. Siyazi ke umama uzoba ne chromosome 21 wakhe aphana ngawo. Kodwa ubaba unale piece le ka chromosome 14 emixe no 21 nenye chromosome ku 21 emixe no 14. Mase sihlangane ke ubaba manje phana ngala ma chromosome akhe sine information eningi ka chromosome 21. Eyenza ukuthi ube umuntu abe ne Down syndrome. Ilapho ke sithola ukuthi i-inherited, meaning ukuthi it passed on in the family. And their percentage is only 2 to 4%. Then kukhona enye i-cause ye Down syndrome abayibiza mosaicism. Basically what that means ukuthi umuntu one Down syndrome unama cells few ane chromosome anama chromosome esithola ukuthi unama chromosome awu46 and then kumanye ama cells awu47, meaning that unama copy awu extra oka 21 ayenza ukuthi abe ne Down syndrome. Leyo type ye Down syndrome is more milder than the other types of Down syndrome that we find. That's why mhlawumbe ama features esiwabona kulowo muntu angaba mild than umuntu one Down syndrome. Last sithola ukuthi unama copy awu3 aphelele kuyo.
Okay. Njengoba kuthiwa udokotela usize kunama test abawenzayo. Ngifuna ukwazi ukuthi should abantu beze kuma genetic counselor before ba decide ukuthi ba fall pregnant or kufanele beze during pregnancy, kufanele ba consult nini kuma genetic?
So ngendlela thina sisebenza ngayo la eGauteng, because sisebenza nama tertiary institutions, sithola ama referrals from our doctors.
Okay.
So kula ama referrals lawa sibabona kuma prenatal or antenatal sebekhulelwe.
Okay.
Baxoxa ukuthi okay, this is a patient of advanced maternal age, sicela babone. Noma kuyenzeka ukuthi lama fetal medicine specialists babona ukuthi mhlambi kunama signs ababonayo ku pregnancy, ababona ukuthi are suggestive of Down syndrome. Bacela ukuthi sibabone and then singaxoxa nomama ukuthi singamofarisha anything as ama genetics.
Okay. Sis Elsie, njengoba usizande sechazile kabanzi ukuthi indaba ye Down syndrome isuka kuphi, kwenzakalani, kanti ke bona esikhathini esiningi bathola ngokuthi odokotela babathumelele uma abomake sebekhulelwe. Njengomake onengane ene Down syndrome kanti futhi usebenza ku association ye Down syndrome, wena wathola nini ukuthi ingane yakho seyine Down syndrome?
Nna ke findile out the very same day e ke krile ngwana hore o na le Down syndrome.
After delivery?
After delivery, just immediately.
Okay.
Because ba bone ka di features tsa hae.
Okay. Ke ne le tse feng di features tse?
Ne ile cause ha sa le monyane matlo ha bulehi.
Okay.
Biana ka ha ngwana setse a hola. Ba khone ho bona mo menwaneng ya maoto. Ba bone ka matsoho a hae and then le nama ile mo molaleng. And then le seledu sa hae le dintshi tsa hae ne di bonahala di tsamaya ka tsela ya molawa ditsebe.
Doctor,
yes ma'am.
I would say no esengaka hore ke tse feng di specific symptoms tsa ngwana wa Down syndrome as le dibile as else ke tse feng tse dingwe tse o ka reng?
Okay, so from sort of where I ended, continuing, so got 20 when I get into the 12 to 14, Ka 20 weeks, then we do other tests, and then ba check a structure sangwana, including what she has mentioned, their central gap feature, if it's there on sonar, right? Then, yes, and then we go into the organs. You go inside. The heart is one of the biggest parts we look at. Kabana ba Down syndrome, babana didi challenges. Other comorbidities, as they are called now. Yes, they are compatible with life, but medically, those challenges in certain organs in their body. So that is why at around 20 weeks, we encourage you to an amniocentesis, or what is called an NIPT. Get tested, then you remember to the lab, and then who identify the chromosomes, and they look at the DNA structure, and then by check is there Down syndrome or not. So in those patients, like we go back to early booking, by the clinicing early, then from there go clinicing realize that okay, we think we need to send to the hospital. Then at a tertiary institution, we are able to identify, okay, we think now there is Down syndrome. Then that's when we bring Zandi in and say, Zandi, we think you and the team, the doctors in your unit, you need to then take the patient over in terms of counseling going further. But with her, unfortunately, then it was at birth, like an incidental finding. At birth, she didn't know throughout her pregnancy. Yeah.
Elsie, after Bauboza, Hashufa ngwana umupila how? Ke sale afika mo wena.
Ke bile shocked because sama thomo ne first time ikutlwa go bolediwa ka lentswe le reng Down syndrome. And then ke sa itse because like le he ba sno ba bona hore ona le features tseo e ba mpotsa ba re no re tlo referela go kalafong. So that by further investigations, and then kasala ke le hanged hore Down syndrome ke ya kalafong hore re ntwe ke e kholo e serious. And then in swere ha hambe because ne ke sa itse hore ho etsahala eng up until ke tlo kriya Dr. Hani explain la pila ka di chromosomes because ne ke ti blame hore ke rileng oh maybe ke boloi so maybe ke papa wa ngwana kore go be le di questions tse dintšhi mo ileng hore ke file ko mafelong ha ke tlo tlhalohanya and then ke bona ngwana hore mo ke tshwere ngwana wa ntliseditseng le thabo le legolo thata biana ka ngwana o mong le o mong ntwene ke itshaba mo yena a se yona mara e le hore ke kreile support ibile Dr. Hani ya ba support group di neighbors family members tsa ka le bona ne ba le teng ba nthusa do ne re sa itse re go etsahalang o hae mara ne re thusana ka hore hae man bona matso ha ya felletse o na le tse tsotle ke ngwana man. So from mo ka kra ile ho thoma ho ba easy ke thomo ho dikamohela hore ke na le ngwana wa nang le Down syndrome.
How to spell Zandi when it comes to counseling? Yes. Ngiyazivela bomake abaningi not nabo baba shocked babe ne fear babe ne blame, you know, abakhansela bathi nje namhlanje ubukele namhlanje ekhaya.
Okay, ngathanda ukuthi as parents we don't have a choice of the genetic information that we want to give to our children. I think any parent would want to give the best of what they can give. So it's not something that you did, it's not something that you ate, it's not something that someone did to you that caused the Down syndrome. It's just something that happened just by chance and was out of control, out of your control. And in terms of what we can offer as Ashilo, we do have a support group that we do refer our patients to Masbabona. I just wanted to clarify, besides Mama Bakulelo, we do see referrals of Antoana, Sebastian, and continue with Down syndrome. Ilapho ke sixoxa ngama different referrals esinawo, and i-Down syndrome support group is one of them. And enye into engithanda ukuthi ngibatshela bomama nabobaba bahluleka ngama challenges ukuba nomntana on a Down syndrome ukuthi psychological support ikhona, and that if you feel like awukhona ukucopa, we're more than welcome ukuthi refer to a psychologist where you can talk about inkinga zakho, and you can also find coping mechanisms from a psychologist.
Okay. Sister Tikhil. As an occupational therapist, can you explain komuto ira grade 12 o batla go ba occupational therapist gore ke ko occupational therapist it's ya sebaka se se kanang kana khanti lena he mo ngwana o na le Down syndrome le tsena neng?
Okay, thank you. Occupational therapy, it's course e former part of the health sciences, and it's a 4-year course. Unfortunately, it's only available at the universities. We don't offer it at University of Technologies, which used to be technical course in the past. So, hore motho a qualify hore a be admitted for occupational therapy, o tshwanetse go dirile maths, science, le biology. Unfortunately, myself, I did physiology, because in the high school that I was in, we were told that how fit like grade 10, if you know you're going to go into medical, you'll follow physiology strain, and if you know you're not going to do, you'll go biology. So, in 4 years, you're training. After 4 years, then how pasa o ya udira community service, which is 1 year, mo bereka actually under supervision. After that community service, then we call you an independent practitioner, meaning that now only to get lawyer, or if you want to go private, you are skilled enough to go. But if you want to remain government, you can also, but now you are somebody that we believe or confident enough or skilled enough akabereka ali one without any supervision. So with tabaya sound Down syndrome, bamosa buletse mo hore kinto lor ha itla it's for everybody unprepared. It's one thing that you know you were planning, we were rejoicing like the child is coming. Now the child comes with all these things, then what? So that's where I come in. Okay. I come and occupational therapy, I become a family member. Because I'm gonna be there from the day it's confirmed in the hospital. Then I'm one person that's gonna walk this journey with them until it can take 18 years. It just that, you know, up until the time that I think the child now lives a meaningful life. That's what we do. Irrespective of what condition or challenges that they might face. Myself as an occupational therapy, I become channeled. I only look at the point that no matter how bad they said, they still can be 1 or 2 things that the child will do. So based on that qualities, that's where I'm gonna take it. So I will start at maternity, maybe if they happen to call me, and then there's what we call preventive reflexes. So you know there are those reflexes that you know, all those reflexes that we know they are present at certain stage during infancy. So these reflexes so that's about no how can you no 18 really kapana really head leg for some time it's got my the problem and open or bana into hypotonia the muscles are one high strong enough ligaments no joint had he strong enough. So that's where I'm gonna come in, as I said, from the day one with the reflexes, because there's a thing that the reflexes they were integrated at certain age, maybe like after 6 years, after 6 months, I don't want to see this. So if it's still present, I know it's gonna create a problem for me. Already I'm dealing with the child that already I know that I need to be
delayed milestones.
You know, or to meet congenital delayed milestone. So those are the things that's where I will start.
o sa bolela ka di-delayed milestone as is ke tse feng di-delayed milestone se o di boneng ko ngwana hao
Ke wa bula an ke ra itse gore bana ha ba thoma a re 7 months o setsa thomo ho a bula ka maoto a haine so because ne ke tla hanyane le ho ithuta ka ho ba le ngwana o ana le Down syndrome dilo tse dintsi nna ne ke lebelletse hore ke batla ho fa yena chance pele
okay
yes so o ntse ka nako e leng hore ne ke ntse ke emetse and then ngwana ha o mokukang ke re wa tsetsepela ka maotong so o thomile ka nako mara ho a bula ke naira bjana ka noga na ha bula bjana ka noga
okay
so ke mo eleng hore di therapist sele ba tshwana go intervene re berekela ka mokho doctor bolelang ka teng hore if le hore di milestones o sala morao ka tsona then o tlo ba le bothata go pele so ke here bereka mo horeng no di exercise kitse le ba re fa di exercise tse o di etsang ba o bontsha pele le bona hore o dira bjang so ra bereka mo di exercises a thoma khono wa bula a ema and then ho tsamaya ho motsere nako mo eleng hore ko sepetlele se le ba tshwanna ke ho mo fa woka
okay
yes because o se le a disturb a kulo ala mo hareng ha process mara le hona mo ho ne ke sa Philippine hore o tlo khona neng ho tsamaya and letsatsi le a thomile o tsamaya ka lona ne ke se awe ke mmone a tsamaya mmolene no ba no male phone later ke tlo mara mosmotho ka jeno thomile o tsamaya and ke mone re thoma re celebrate re etsa so ba etsa dilo ka nako ya bona and then ba tlhoka hore le rena re ba encourage and then o be le pelo
Doctor, o boletse ka procedure engwe le o re la hira as gynecologist wa re amniocentesis o ka tlhalosa ko motho shebeleng TV hore le hira bya amniocentesis and it tlo thusa ka eng after le hira because ba bantsi ba etsa ba hore once ba thoma ba re amniocentesis le nna ke le ngata bana ke no re yo ke tlo meskela you know a re tsemo
so amniocentesis it's a procedure e re etsang in pregnant women, ne? And then the earlier the better, the 20 weeks and less, or the just after 14 weeks and before 20 weeks, area 22 weeks. Ne? To find out about the genetic abnormalities. Ne? So basically, in the pregnancy itself. And we know that a fetus is inside water. Yeah, so and we suck the water out. Yeah, about let's say 10 mils of that, and then rawangarwa rumada for investigations. Yes, in a there's pros and cons to it. You know, we are not saying it's again. I'll bring the word risk. You know, we are not saying it's going to happen. Okay. We are just saying it is a risk when we do it, but we have to do it. But every 99.9%. It goes well. There are no problems. Yeah, so miscarriages, we talk about that. In an Rh negative patient, that's the blood group. Rh negative, the crossover of maternal and fetal blood together. We worry about that. Yeah. So we discuss those things. The patient, counseling as well. It's part of counseling, and then it probably just takes less than a minute to do an amniocentesis. Okay. It's just the understanding why are we doing it. And for the benefit of the parent to know exactly what is there an abnormality that we are facing and how do we deal with it moving forward. And the reason why most of the time these are done before 20 weeks, we are also guided by rules and regulations of termination of pregnancy, right? Yes. Because there's going to be, if let's say, it depends on the parents. We know that one hour Down syndrome, but we know only the challenges going forward. But there are a couple that will say, we don't want to keep this baby. So then the reason we want to do it earlier is that if there's got to be a medical termination done for the parents, then it happens early in the pregnancy, before there's too much of a bond and before we go beyond the rules and regulations. you know, the guidance medical termination of pregnancy. Yes.
Also, the rights, especially the termination of pregnancy. We just lost our Prof Mhlanga, who was the giant and who was the one who made sure that that regulation, that law is being passed by our government. City
Yes. Yes.
Doctor, there are other tests that you do.
Yeah.
Something. Test early
So between 12 and 14 weeks,
Yeah.
that we do blood tests. Ne? Beta HCG, like I said,
Yes.
or HCG, and PAP A. Ne?
Okay.
Then basically other things are measurements. You measure the neck, whether the neck is, you know, there's numbers that we work on or a range that we work on. Ne? Then you measure the thickness, this part. We call it nuchal translucency. Okay, and then the thinner, the better. The thicker, the more now we are worried that there could be an abnormality. Okay, then ditsebe, like she mentioned, low set ears. Okay, it's one of the features you could think there could be an abnormality. Okay, then the nose, flat nose, and then the lashes. Okay, and then the slit eyes as well. We look at that. Yeah. Then when you move to other abnormality that go with Downs, because it's 21, 18, and 16. And is it 16 or 14? Patau, Edward, and 13, 18, and 21. Sorry. Yeah, 13, 18, and 21. The head itself, the shape of the head, you look at it. Okay, it's in the, you know, there's a change of shape. Yeah. We know in Downs it's broader like that, but then Babambabale, this small head kind of thing. Okay. So those are the features and more.
And more.
Yeah.
Let's go to more, Zandi.
Yeah.
Especially when it comes to the oral part, where most keep him. I understand what it is because let him or
okay. So ngizocoverisha wonke ama-features esibona emntwaneni one-Down syndrome. So sikhuluma ngaba arm slanting eyes, ila sibona ukuthi amehlo egcineni aphakeme kakhulu. Siphinde sikhulume ngempumulo noma i-bridge yakhona sibona ukuthi i-flat. Mase sikhuluma ke ngelimi lakhona bayibiza i-macroglossia sithola ukuthi abantwana be-Down syndrome bahlole bakhiphe ulwimi because of i-chin le abantshela umama ngayo ukuthi kunokuyenzeka ukuthi ihluleke ukuthi ihouse
the whole tongue.
Siphinde sikhulume ngeindlebe, indlebe ziba low set zihlala phansi kancane. Siphinde sikhulume ngentamo, iba mfishane, iphinde ibe ne-fold la emuva. Mase sibheke izandla, siyazi ukuthi iminwe i-short. Siphinde sibheke lama line lawo, siyazi ukuthi thina abantu abaningi awu-3 ama-line akhona kodwa mase sibheke umntwana one-Down syndrome sibona ukuthi une-line A1 ehamba across. Siphinde ke sibheke inzwane, siphinde sibone le sandal gap la bakhuluma ngayo ukuthi kune-gap between lo munye omkhulu nalawa alandelayo. And then sikhuluma ngama-features nje siwabona ebantwaneni abane-Down syndrome kodwa kunama-structure, izinto ezenzeka ngaphakathi esingaziboni. Inhliziyo uDr. Yang akhulume ngayo ukuthi siyazi ukuthi 50% yabantwana abane-Down syndrome baba nenkinga yenhliziyo. Siphinde ke sikhulume ngengqondo ukuthi iyaphazamiseka nayo ukuthi sazi ukuthi abantwana abane-Down syndrome baba slow ngokukhula ngokureach ama-milestones abo nofuthi nakhona futhi ukuthi ukucabanga kwabo kuba slow. Ilapho ke kudinga ukuthi umntwana one-Down syndrome aye ku-special school. Ilapho ke bazomfundisa ukuthi akhona ukusebenza ngezandla zakhe because siyazi ukuthi make ya ku-mainstream school izinto ezifana ne-maths ne-physics uzohluleka ke ukuthi akhona ukugraspa lama-concepts lawo. So ukuthi afunde ukuthi asebenze ngezandla zakhe kungamnceda going forward.
Ke rata thata part ya mlomo because mo ngwaneng this is the main thing so far. Ngwana o tshwantse a nyanye, o tshwantse a je. Ha o sentse o buletse bana ba le hypotone. O tlo nyanya byang bya nomo. Mme o tlo mo feeda byang ha di go hae.
Ke hona mo lo re tsena teng even la ile re rona ha di re much on the low oral motor.
Yeah.
We usually refer to the speech, but like I said I'm one of the family members. So seeing that the child has got low oral motor, I won't say I'm not gonna do. I still have to do part of it. So usually what happens there is that because the muscles of in the mouth, they are very
The legs.
They are the legs, meaning even to keep food in the mouth, it's a problem. And now we know that we need this for eating, for speaking. There are many things. So we get some activities that we will do, like blowing, just to strengthen the muscles of the oral motor, so that we know. We'll tell them, like, give them the straw. We start with the big one. Isn't it true? Squeezing. There's one thing I used to use back in the days. They used to have this toothbrush that, you just desensitize the child, so that, because problem with low oral motor is that, remember, it's going to create a problem in a way that the child is going to be picky, because now the muscles of the mouth are too weak. So when it comes to solid food, they will stay away, because now they don't have that capacity to chew. Yes. So now that's why I was still like, while I'm training the child, this one, even though the speech therapy will take it further, but you will incorporate it in our therapy.
Okay. As is, ngwana wa thoma since a tsamaya ka thuso ya di occupational therapist. Heri ya byanong hape ngwana tshwantse a ye sekolong. How old is she?
She's turning 12 years in November.
12 years, okay.
Yes. Ka skolo re lebelletse hore bana ba e leng hore ka ntle le Down syndrome hona le bana ba e leng hore bana le di conditions tse e leng hore rena re le batswadi re nahana o ka re ba ka se khone go sekolo ba ka se fitlhi, and then a se mo ba tshwanetseng ho ba moteng. Okay, nna ka boikgantsho ke thomile go creche na tsena le bana bo botlhe crash, and then ha ba etsa diraeme o teng mo those speechiness is teng mara ka di action na khono mpontsha hore ne ba etsang. And then hono byanong o tsena mainstream school. Wow, she's in grade 2. Yes, and apart from we can't hore na le bana ba bantshi ba eleng hore ba tsena mainstream school, and then wa gore ho bonahala hore no ho na le
Progress.
Yes, progress e teng. And then the therapist adisale feel. Yes.
So the speech therapist teng mo ke tse feng di therapist ding tse nyakegang pila mme a goditsa ngwana o na le Down syndrome.
Re tlhoka go thoma gore tse tsotlhe actually, because re tlhoka di areas tse tsotlhe tsa bona.
Okay.
Yes, including the dietitian hape re tlhoka. Yes. So he ngwana a tsena mainstream school, bona ke bona ba ileng hore ba trainilwe ba itse hore ngwana a achieve milestone e rileng tshwentse re etseng, like o thoma ka fine motor skills tshwentse re fe ke bona. So ngwana has na fine motor skill a ka se sekolong cause a ka se tshware a ka se khone thoma pen, and then re encourage early intervention. So re thoma kae hona hape go di therapisting, and then le motswadi a tswella pele go high. So he ngwana a thomile ka tseo ha ya sekolong a hobe le boima bo bokalo, cause ngwana o setse a tlwaetse ho tshwara pele, o sa tswe a tlwaetse hore ra trainer kana go e rileng, cause le routine is very important. Ngwana ha e le hore ha na routine o tlo kry le hore kana go e tshwentseng a nne fatshe a pay attention wa ema. So dilo tseo ke tse e leng hore ke dithuto tse re di kry-ang go di therapist.
A bolela ka define
Motor, yes.
le guys ho na le di cross
Boss and define.
ke go pelo tlhalosetse motho sa itse
No,
mo
ha,
no mo
Re na le di tshotse re bitsang ka re ke fine motor and the cross motor. Ke mesifa kapa di muscles the tshebetso ya di muscle ka gore di muscles di divided ka big and small. So cross motor ke tse kholo, di fall under gross motor. Then re na le bo fine motor e leng tse nyane e leng tsona tse tsa bo ngwana. So khona mo lo re e challenge a bona because ha e lo re o na le ngwana e lo re o na le Down syndrome o ipotsa hore awa nna ke tlo mo godisa the way ke godisitseng ba bang. E ba difficult because with Down syndrome we'll have to start from the basics. And now that's where mama boletse something ya hore ngwana o ne a bula ka una khasa ka mbasa khasi ka mogore batla. So how fitla kwa rona OT how khasa o sweta e ka re kwena noga elari it's not a tick for us. It's not an achievement. We'll still go back to retraining ya crawling which is 4 point kneeling. 4 point kneeling I kere ke khwatlisa magetla ke khwatlisa le mangwelo hore ngwana ha tlo yema ha tlo ngola ke tsona tse ke di dirang jalo with fine motor hore ke train ke qala mo pele ke qala le kgetleng ka builda di muscle tse le tse kgolo. So once you build le muscle tse kgolo tse nyaneng di ba easy mara jwale tabeng ya Down syndrome e ba difficult ka baka la hore ha re gopole gore menwana ya bona ke e mekhutshwane matso ke gore matso bona ke makhutshwane. So hore re mo le kona mo le will go extra mile. We will train them with every basic thing because if other kids, once you know that shoulder girdle stability is strong enough, you know you will get there. But with Down syndrome, you'll find yourself doing fine motor coordination, picking. And this is one thing I love about is a go batswadi. Taba ya gore therapy rona ke right ba gore re approach ngwana ka technique ife. Kana le yona e re bitswang ka gore ke NDT. Technique e lo re ke neuro developmental technique mo le re khwatlisa di muscles anything that has got the neurological wiring and everything. Then re na le ngwa ba re ke sensory integration yona ne re bolela hore ke ya bo molomong because aba khono sensor like any other person body balance is part of sensory integration.
Okay.
So ha ba tla kwa hore na batho bana na rona le maybe mochino ro tlo ba dira re di rekisa the activities lo ngwana ha lo re ngwa bana ba nako ya ha ba 6 months ba khasa ba 5 months re tla be re dira that growth we will reinforce it. So we believe that by doing repetition also the brain learns.
Yes.
We are rewiring the whole thing so that we follow normal developmental milestone even though ngwana re tseba go ona le di challenges. So one thing you know re nda ke a irata go re nna ke ba botse ntwiwa ka o tlhakane le dan re tla be re boletse ke re nna ngwana Down syndrome ka bana ka ofela ke ikopa re mo hodise Sesotho because ngwana o na le mathata. So ha ke mo hodisa Sesotho ke tsele tsa hore ke mo hodisa ka tsele le rona re gotse ka yona rona le re bona o no sena di botsele re ke di walking ring di bete di cord bete di one.
There was a box.
There was a box
to sit.
You understand? So re start ka mangwana ke a bolsa ke re nna ke a tseba hore batho ba fashion ba tsatsi ya once motho a emetse ngwana o ya kwa gore o dara bete nna bete la ke nyaki ngwana o ke nyaka go ba le lwena attachment ke a nyaka because remember these kids they are the kids they later in life they are going to suffer what we call
they feel
marginalized
and rejected.
You know, rejection. They are going to be deprived from certain activities. So ke rawa na ke sa batlela ngwana ro bala liwan because of my isolate ngwana when I also reinforce withdrawal symptoms ngwana e sa lo monyane ro bala le ngwana le re tseba ngwana le ba attached social tomorrow re bereka ka di social interaction skills re a tseba hore ngwana o na le that because gopola hore like Dr. Boletse pregnancy in 9 months ne le together for 9 months. So now ngwana o fitlile o so mo latlhela ko mbeteng that on its own it can even cause another delay because now you already provided rejection and then ngwana o tshwantse iphandele. It's not like that. So also the thing about the walking ring. Exactly, Dr. Mokoape said.
I've heard that from physiotherapists actually that they don't encourage walking rings. They want babies to just do it on their own, you know, until they stand and walk on their own. Yes, because the walking ring, I mean, they slide on it, so it's going to that fine motor skill.
Yes.
That's where it's going when they start school. That's where the problem is at the same time.
So walking ring remember banaba working room, they
They
walk
tiptoe,
on their
yeah,
toes.
their ballet
Already
dancers.
automatically means we have got what? Balance. And the vestibular is problem here. So, and I'm gonna need that balance. Balancing, I need it for concentration. So now, if you are going to put the child to walk on the toes, you're already affecting the balance that is not there. That is not intact. So that's why I'm saying we go to
Allow
the
nature.
traditional, allow nature to do work.
Okay. So as in school, concentration, the attention, ijwa ngoyeni.
Concentration ya high I tshwana le ya ngwana o mong le o mong because wa itse hore ha re le mo classeng re tlo utlwella a re interrupt and then le who like aso thomi speech sa ya se tswele kontle so teacher wa hae o setse a motlhalohanya hore o ka reng ha e khone pila e re ke mo fe activity e a yetse so ka re ngwaga e sa le hona o thoma and then ke teacher o mompya re sentse re berekana le yona eo hore re mo thusa bjang re tshwantse re thuse teacher re thuse le ngwana
So esobulela bura hore ngwana o na le Down syndrome ara tshwana o conclude hore they cannot go to men's school and then tshwantse just be special school only or
no ara tshwana go conclude na I believe hore ngwana o ana le Down syndrome o tshwanetse go gola bjana ka ngwana o mong le o mong so ke believer hore o fa ngwana chance and then get a bona hore ena o tin super in and then apart from skolong fela le ka mahai o khona mmona hantse a hola hore okay o rata music ngwana and then o ka lebella ka mo music while o tlhakantshitse le dibuka because skolo se important ngwana mo le mo o na le tokelo o itse ngwana le bitso la hae o na le tokelo ya go itse age ya hae o na le tokelo ya go itse gore ke la bokae ka jeno and then o na le tokelo ya go socialize so ha a setse a tlhakane le ba ileng go let's say ke bana ba ba nang le Down syndrome fela mo skolong se se rileng sa bona fela so ba tlo phela gona go lefatsheng lona so go tswela kwa ntle go yo bona bana ba bangwe go wa mothusa le yena because o bona gore o gola ka stage se e leng gore ngwana o mong o gola ka sona and then se mo fa opportunity ya gore le yena a ska ba le low self esteem because ha re gola go metlhe e fetileng he ngwana nana le condition e rileng gore e ka ba eng kampo se bopego sa mmele o sena condition ne yo fa stigma ne yo fa stigma o kreba o bitsa ka ntho e nngwe fela so le bana hono byanong ba tsenang le bona skolo a ba samakala ho una le friends e ke molata go skolo nna go nngwe kre a sampone ke me and then ke lebelletse fela hore mara go etsa halang out of my absence ke mmona hore no una le dichomi mola and then ba busy and then ha aboa le ha e le hore a ke mmotsisi o tlo mpontsha gore ko skolong ne ba etsang if ne ba bala di numbers o tlo nkirela di numbers if ne le di alphabet if ke ntho e le ne ba etsa mo booking o tlo tsia buka o tlo mpontsha and then ke mo byanong ke tsenang le ena
I think sometimes okay
I just want to just to add on I think also the importance of extramural activity should come in the sports you know because the more active the more the brain works better as well you know and memory as well so I think it is important to bring that aspect into the child's life and also to make those that are not disabled, if I may use that word, to know that you need to learn to interact with each other, you know, and normalize it, you know,
So I was else, Ashufa here, Wahutla Hohai. Bona ka no re spoiler bana re na le helper nka re ra barata mara ba spoil aba itse lo apea aba itse lo tlatsa dibiana wow ba re the home
chance
o jwa
hey o teng ka mo kitchening o teng ka mo ntlong cause like a ka se nne go di chileng
Why?
And then le ena a ka se nne a le ditšhila and then a ka se nne ka tlala though ke sa le o mokhutswane for a ka ema ko stopong and then ke a itshaba le ketlele mara o khone hore ha tshwere ke tlala o tseya borotho a ntsha peanut butter di beile mo gaufi for yena tse e leng hore a ka khone o di berekisa so independent independent like o tlhatswa di biana and then because ke nagana hore ntho eo hore a khone ho etsa re mo treata biana ka ngwana o mo le ka mo because abuti o na le tse tshwentseng a di etse le ausiwa hae so ba rotate so ena o tsena mo hare mola ha ba staying o etsa ka pele hore ha ba bua a ke ba kre a feditse
then that is important
And I think really the rank is good because remember when the inclusive education policy came into
practice
it's exactly what they were trying to say or ha re ruteng bana ba rona hore hona le bana ba so ba tshwantse ba amoela irrespective ya hore maybe how good
the challenges or not
one or two things and once bana ba ka ba kana mkhono they will never even have that mentality or kana wena Down syndrome and it's quite interesting because bana they learn from each other now that the child has got a speech problem if he happens to interact with the ones that are speaking you'll be surprised
the child will speak
and because we usually see it like your child will be having a neighbor wabulela Sivenda your own child is already speaking Venda without you knowing so kids learn it quicker from each other and the only thing that we need to do as parents and as a community to encourage that acceptance amongst each other love because we learn from each other remember not like I said I'm gonna walk this journey ufihlile skolo no wa cope like mama boletsore even though yena dilo tsa a lot of repetition whatever that they do we need to repeat but at the end of the day the child will get into the tune so what happens is that with psychological tests especially body your IQ test isn't it they come later in life and we're not gonna fold our arms and say no we'll wait for 8 years or 10 years for the child to qualify for psychology test so in the meantime like I said I will be looking at the fact that I'm still going to train you cognitively as if you've got a normal IQ we will see how far it gets us but what matters is that let's try and see how far we get so by the time they even go for educational psychologists for those tests you find that the child is already flowing in the school and then that's where nowadays we have a lot that are now inmates through school which is good because now remember even if the IQ will come back later after the child is already maybe in school and say what do you call it only mild IQ or they used to call but mental retardation no longer these kids that have mild we believe that they're able to attend school until the 9th grade. So you see, there's a lot that these kids can do if they can get to high school.
The 9th grade,
By
skills development.
That's where now we know we will refer the child to skills development for vocational training so that they become what? Independent adults. They also contribute to community, to society. They generate them because tomorrow I want to see them married, having families, because they are like any other kids. It's just that they have one thing that we needed to deal with.
I like the part area independent adult because me Elsie a read to autopillar until me and then hamushia alijwa that how do you find it and how are you preparing your own child to be an independent adult
No I gave so ki thusitse support group Yabo Member Down Syndrome Association. Yes, because if Lohuri Nikita Makili one, because Banavarna Havalikani, only 13 years, Waka only 7 years, I on number 7 years, so ki Tokamuto Olan and Liwa 13 years, so that only experience and then Linna Ka Kepiona you, Econon to Sahuri. ke lebelele dilo ka tsela e nngwe. And then ntho e nngwe hape ke hore wa bona ngwana o ese ngwana le Down syndrome fela. Ngwana o molomong o khona ntho e a etsang ka support, and then ngwana o anang le Down syndrome le o asnang yona o etsa dilo tse go high a di bonang le di etsa. And then inclusively ka mogare ha lelapa o ska re ngwana o na le Down syndrome and then ha le bolela like le TV and then bona mamang or yo ke rata attire ela or ke le yena mo include mona, and then o identify ntho e a ratang. Not like hore o na le nako every day mara wa mo support. Let's say we can't rata music, so channel e nang ile on ke ya music, so hona le nako e leng hore ke dipana go le yena, and then re dance, and then hona mo o khona bona re okay ngwana ka o khona di ho etsa di moves tse kana le tse kana, okay a ka etsa ballet or gymnastics or yes.
Okay, Zandi, sesivala manje kubilo sekhaya. Namake usavalela umntwana endlini uyasaba umkhiphela ngaphandle une Down syndrome, usazi blame ngalokho nalokhana. Ungamducuzela uthini nje namhlanje?
Bengathanda ukuthi njoba sesishilo ukuthi umntana one Down syndrome ufana nomunye umntana udinga uthando, udinga ukuthi simnakekele njengabanye abantwana, simfundise njengabanye abantwana. Ukuthi siyazi ukuthi abantu bazohlala bakhuluma ngaphandle, kodwa wena fanele ukwazi ukuthi umntanakho udinga uthando nokuthi ama challenges akhe ayini, nokuthi wena as umzali ungamsiza kanjani umntanakho.
Okay, sibonge Dr. Motlatsi. Ngibapho yithi ukuleleba
Listeners,
yes,
the viewers.
More the viewers. Hore. King, why is it important? Or how we mean? We go clinic nthola ba re ke scar sela. Ho baneng se le important scar?
So what we call antenatal care is very important for every woman who is pregnant. Like it or and journey with you to delivery, because there's a lot that can be identified during journey aerona to delivery. History, what happened maybe with the previous pregnancy, like I said. If you have never been pregnant before, yes, you are pregnant now, so what are you about? Like a medical history. Are there any diseases that you have that might affect the pregnancy? Like diabetes, hypertension, you know, a whole lot of other common thyroid disease, a whole lot of other diseases. Number two, about the operations before or not, it's going to affect what's going to be happening in pregnancy. Then social habits are very important. What's Uber now? How's Uber? We are already, it's a no-go area. You know, we know your risk goes up. Alcohol, we know drug abuse, we know all those lead to what we call prematurity and fetal alcohol syndromes and all, isn't it? Then the good thing about antenatal clinic, it's nutrition, because the placenta needs to be fed. Remember, pregnancy is about the placenta. Placenta through the cord, it goes to the fetus. So if we don't talk nutrition, then we are not helping this woman. Understand? Anemia is an issue in pregnancy, especially iron deficiency anemia, because our patients are in their homes, and we are not talking about expensive food. Simple foods, simple vegetables, simple foods that you can buy. You know, you spoke about peanut butter, it's protein in peanut butter, you know. Cabbage, there's some folic acid, ferrous sulfate there, iron, spinach, you know, to assist. So you teach them in order for us to have a baby that's going to be at a good weight for delivery. End up in ICU, struggling, you know. So that is why we talk about early antenatal care. Much as my passion is on contraception, because then we don't want unplanned pregnancies. Like planned pregnancies and pre-pregnancy counseling for those that are planning to fall pregnant. That's my word. Yeah, thank you.
As an occupational therapist, the importance of an early intervention ya di-therapist?
ntho e ke nyakang ho ipotsa babupi ko gae kore dilo tsele tsa gore bo Down syndrome, di-cerebral palsy ke kana re di bitsang ka Sepedi ba re ke di felela metseng, meaning
Secret.
ke di-secret ha e sa le tsona ha se boloi ke ntho e le gore re phela le yona ene thuso e teng as long as motho o identify jwalo ka bo doctor se ba boletse gore once you pick up one or two things, even gona mo sepetlele ba boditse or one, you come to us, then we will walk this journey. As I said, I'm there with them like 18 years because I will even tell them at 18 years, like I think this one it's for semi-skilled, the other one is unskilled. You know, there are those jobs that are they're in the open labor market. It's not like we are training them to come and be in the what do you call it? In the shelters, yes. But you know, to compete with other people and you know generate incomes like everyone. So now the early, if you realize the earlier the better, because you're able to do like as I boletse ngwana wa tsamaya ngwana tsena skolo all is well, all because everything was done early. And it's actually one thing that I was struggling with when I was in government. I used to run I used to call it baby clinic, which was on Wednesday. You would be surprised that I would see like 300 kids. Those kids were having like different disabilities. And it came exactly to what the doctor was saying, like we would expect, as Sister Zandi was saying, like, you know, you'll think people that are high risk are the ones that are at advanced ages. So here I was sitting with about 300 kids and over 60% of the mothers here were the teenage mothers. And the young ones. And now, remember, this is the person that maybe made a mistake or fall pregnant unplanned, as Dr. Mokoape said. So now she was thinking that after I deliver, I will rectify my mistake and go back to school. Now you are sitting with this. So now education, let's educate ourselves. As whatever that they tell us in the hospital during pregnancy, let us do it. Because it doesn't only benefit us, it benefits the child. And it also saves you as a parent, you know, a lot of time to be going up if the thing could have been prevented. Let's just adhere to how our healthcare professionals are guiding us and, you know, advising us. And if we realize that there's a problem, our doors are always open. I believe in nowadays services are accessible, unlike in the past where, you know, occupational therapy was one of those things that are not known in the black communities. You will come and they will say, what do you do? Are you a physio? So, but right now we are living in times where services are accessible and are available. Let's just make use of them.
Make use of them. Askes, ke batla byanong o re botse pila gore es o bereka go Down Syndrome Association. E bereka ka eng? Ke eng o irile gore o be le lerato? Is it because of ngwana hao or le bereka ka eng tsa mathomo je?
Okay, ko Down Syndrome Association of Tshwane, re bereka ka batho ba botlhe ba ba nang le Down syndrome.
Okay.
A re kgethe age, a re kgethe gore o ko kae. So re thusana le bona ka since early intervention, really important from birth. But baba dipetlele di ba romela ko rena ba bang ba re kreya mo Facebook, ba bang re na le ho ya dipetlele di clinic mo eleng ho rira awareness every week. Re na le plan ya go re yang ko teng. So e thusa hape le ka ho supporta di families bjana ka he ke tlhalositse hore nna ne re sa tlhalohanya Down syndrome ke eng. So o kreya e le hore ho na le family ka mo hae papa le mama ba lwa hore wena o ntliseditseng motho o moso le mama le yena o setse ana le problem e la hore ha so amohedi because a re tshwane nke. Yes, so ke mo e leng hore association ya rona e thusa batho ba ba nang le Down syndrome ka tsela eo. And then re na le sports,
Right.
re na le di-activities tse dintši tse e leng gore di fapane go ya ka di-age groups. Re na le outreach program e ke setse ke boletse ka yona ke ya o ya ditleliniki dipetlele mo e leng gore re fa community awareness, because ko community o kry-e le gore a le bona a ba itse gore go etsagalang. So ha motho a feta mola or ba bona ngwana wa tshameka mola ba mmitsa ka mabitso a e gore a se ona nkere ra itse gore re fana mabitso rena nkere, and then o kry-a e le gore le batho ba bang a ba so tlhaloganye o utlwile fela gore o na le Down syndrome, so setse bjanong e le Downs. So re rotloetsa batho gore mo mothong o a nang le Down syndrome le ha o e tlhalosa o setse o tlhalosetsa batho motho o tla pele, and then a se di Downs ke batho ba ba nang le Down syndrome. Yes. Yes, so ke phoso e leng gore e etsa ke motho o e leng gore a so le dikitso. Yes, cause he re di Downs re setse re gatella stigma seno. Yes. Yeah, and then re na hape le school to work program. School to work program ke mo sister doctor setsa tlhalositse gore o gola le batho ba ba nang le Down syndrome, ne ke mo e leng gore re ba rutela go yo bereka. Yes, re na le literacy program e leng gore e riwa ka tsela e fapaneng mo e leng gore e ruta ngwana go ngwala go bala at the same time ngwana o dithutela go bereka. Re na le hospitality bjana ka he motho mang le bang ana le career e a batlang le bona ba teng ba e leng gore ba dithutela go apeya. And then re na hape le computer skill ono bjano a nkere re tsamaya le dinao, and then bana bo botlhe ba setse ba tloa kore o setse a tlhaloganya go khotla go phala rena ka technology ke yona. Yes, so ke mo e leng gore office ya rona e thusa batho ba e leng gore ba na le Down syndrome, and then re celebrate hape di kgwedi tse e leng gore di khethegile mo maphelong a batho ba ba nang le Down syndrome. Ke March le October bjana ka setse o tlhalositse ka extra chromosomes, so ke di 21 ke extra chromosome e leng gore re etsa awareness mo e leng gore re bitsa motho mang le mang atle a tlo re joina a tlo ithuta atle a tlo ba le rena a shere letsatsi leo le rena. And then re na le la October hape mo e leng gore bana ba rona ba fiwa opportunity ya go tsena ka mo groundong ba bontsha bokgoni bo banang le bona ka di short put dilo tse tsotlhe tse e leng gore di include di athletes ka letsatsi leo. And then re na hape le soki ankere ba gola ne so motho mang le mang wa golang o ba le mo staging se se rileng. Yes, le bona ba fitla mo staging sa gore o batla go tswa di out. So bjana ka mabane ne re na le soki mo soki ke mo e leng gore ke mo ba ithabisa mo teng ba dancer ba socialize mo teng. And then re na le ECD program e leng gore ke a bana ba from 0 to 11 years mo e leng gore ba tloga ka dibese go di areaeng tsa bona a re so ire di area tse tsotlhe mara re catera di area tse 5 hono bjanong e batlisa ko office mo e leng gore ba tlo bona di therapist mahala.
le la no ba fumana hore maybe because ke bona ka bontšhe ba bona gona le banyana bashimane le ba kry-a gore ba ratana.
Yes, re na le di-couples tse ntši.
And then ho iragalang ka ngwana is it Zandi go wenzakalani abantwana go ba Down syndrome or go wenzakalani?
So usually in males we find ukuthi they unable to have children. So
abantwana babafana ba Down syndrome abakwazi ukuthi
And the females?
That too.
Yeah.
Yeah, both males and females.
So fertility is low,
Yeah.
basically.
Oh, okay.
My question, to you as a mom is it just came about now that you've got a teenager now, or to starting to menstruate at some point. Does that come to mind, and do you sort of try to think, what is it that I'm going to do once we get there, because it is going to come.
Yes,
Yeah.
that ke part e nngwe e leng hore hentse a ya hola, cause hona ba no setsa thundo tswa dikolong lore and re setse re itse ka ntle le go bala hore ngwana ha tswa dikolong lore ho latela eng. Yes, so le yona eo ke lebelletse, and then ka bona hore ke tlhoka support. Ka boela go kopa thuso mo ba e leng hore bana le bana ba ba setsana ba ba holo hore wena ha o fitla mo breaching e o tshetse byang. So he a tla ka di ideas tsa hae, cause ke ile go yena ke itse hore ke ile khopela thuso already, ne ke setse ke na le di ideas tse ke nang le tsona, so ke ya di combine tse tsotlhe. So now ha so thome, but we are already on a
Talking about it.
on a process of practicing.
Yes,
like
yes.
Sifunde kakhulu namhlanje bakubuyela emakhaya uzwele umntwana ozalwe ne-Down syndrome umtreata njengabanye abantwana abanormal, afunde kanti kubalulekile i-early intervention yama-speech therapist, yama-occupational therapist, yiyo ezosheshe incede kakhulu kulabo fine motor nabo gross motor. Kanti-ke ama-genetics akhona nabo azokunceda kakhulu ukuze usamukele lesimo. So akusenazo isidingo sokuthi umfihle, usakuhamba naye edrobheni, bangaba involved even nakuma-sports. Ngiyathemba ukuthi nifunde kakhulu lapha emakhaya, nisale kahle.